Good morning, good afternoon, and good evening, everyone. We are now starting the TICAD8 site event, Digitalization of Maternal and Child Health Handbooks and Information, Benefits to Mothers and Children, and Contribution to Public Health in Africa. We would like to thank you all for joining us here today. My name is Mizuki Kato, and it's my great pleasure to be the moderator for today's event. First, we'd like to present the visual message from Professor Miriam K. Were awarded the first Hideo Noguchi Africa Prize in TICAD8 at Yokohama in 2008.
Speaking. Okay, thank you. I am very happy to have this opportunity to talk about Mother and Child Handbook, the MCH Handbook. I like to talk about it because it is one of the best innovations that came across. When I was in Japan in 2008 and came around to know about the Mother's Handbook, which became the MCH Handbook, I thought it was a wonderful contribution by Japan to the world, and I still think so. After that, I was very keen that this handbook becomes a reality in Kenya, and I'm happy to say that we now have the MCH handbook in Kenya and in many other African countries. In Kenya, when I have visited every health center, I find that mothers coming for mother-child services come with the handbook, MCH handbook. And this is wonderful because they can learn by themselves on the handbook. I have found that many of them come and they ask questions about what they don't understand in the handbook or what is not clear in the handbook. And this means that they are using it, they are reading it. And so to have this in the hand of every mother is a wonderful approach. And I have congratulated the Ministry of Health of Kenya for this success. And the next step, which is to make it digital and move it beyond being just in a book, is a further development. At the moment, I don't think many mothers in Kenya can use a digital handbook. But we are thinking about the future, 5 years, 10 years from now. And many of our children are learning digital things. And so a digital handbook will be very useful to them. It takes away the fear that I will lose the handbook. That if I lose the handbook, I will lose all the information in the handbook, and so on and so on. So it is a further assurance that the mother and child can get their services at all times from anywhere. And this is really a wonderful, wonderful provision. When I was a young doctor in the early 70s and was working in the clinics including looking after mothers and children, I remember having to worry about so many cards: the antenatal card, the delivery card, the postnatal card, the family planning card, and so on and so on. And sometimes these cards, even for myself, they got lost. I would put one somewhere and I forget. I forget that I have put it somewhere. And I found that my fellow mothers who came to the clinics were also, sometimes they left one card. When they came to the mother and the family planning card, they come with the antenatal card, or they come to a postnatal clinic with antenatal card. But having it in one record, the MCH handbook takes away all those problems. And I have seen how relieved mothers have been, because it's also much, much more difficult to lose a handbook than to lose a card. A card is just something that you put somewhere and you lose, but a book is not. So the whole idea of the MCH handbook has been very handy. And digitalizing it will make it even more permanent. Permanent to those who get to it, permanent to those who use it. And as mothers get more and more involved in IT matters, they will be able to have this record forever. So I think it is a wonderful development, it's a wonderful movement, and I always tell my Japanese colleagues that it is another one of Japan's major contributions to global health, that we should recognize this as a contribution, and I thank them for having worked their way from the mother's book to the mother's handbook to the MCH mother-child handbook between 1948 and now. And I'm happy that it's now a global ownership. It's now a global event. The mother-child handbook is now a global event. And I'm happy to say that most countries in Africa now have the MCH handbook in the booklet form. And I think now we can move on to the IT to MCH digitalized form. So I think we are moving forward, and I'm happy to say that we in Africa are not being left behind, and we don't want to be left behind. Let us move along with the MCH handbook in digital form. Thank you very much. Thank you very much.
Next, we will have a welcome speech by Professor Keizo Takemi, a member of House of Councillors and a WHO Goodwill Ambassador for Universal Health Coverage.
ご紹介に預かりました。
Thank you for your kind introduction. This is Takemi Keizo speaking.
この TICAD8 のサイドイベントとして、
As a TICAD8 side event, we are going to talk about mother-child healthcare handbook and how we can digitalize and how we can contribute to the health of mother and the child. I am truly happy and honor this decision that you have made. And with my respect for the Dr. William Vele, she has explained how important it is to have this type of system. And in the 75 years after the World War II, this truly remarkable invention of MCH handbook. And this handbook has largely helped the recovery of the nation and has played a crucial part in terms of the improvement of community health. And having said that, Japan has been in its effort to provide support for the developing nation and has been taking initiative to promote this handbook for the wider use beyond the border. And this new system, why are we thinking about digitalization of this handbook? For this, I think we have to go back to COVID, the pandemic. This has a crucial key. In Japan, we have COVID just about 3 years, and we realize how important to keep the information right with regard to the health of individuals. And however, the unified management of those clinical information has not been done. So sometimes to take the measure there's been a delay found in taking the measures. So reflecting upon this experience, bitter experience rather, we now have to work on the electrical chart or digitalization of electrical chart, as well as unifying the system or standardizing the system. And to this end, obviously, these are the individual information, personal information, and the crucial part has been played by the child and mother-child handbook. So this has been the crucial part of this system, and now as we are promoting this digitalization, we would have to think both the elements. In Japan, we have been digitalizing everything, and let's not forget about the medical system as well. The cross-cultural collaboration has not been done yet, unfortunately. So digitalization is taking place quickly. So I think if we try to systemize where digitalization has been already there, and it might not be a good idea because those new system and the older system can conflict each other, and then we might face difficulty. I don't think Africa is that. Africa is not running that risk. To begin with the digitalization of MCH handbook, I think Africa, in the process of digitalization, when you are moving on, you can reflect upon the local or region who has already digitalized the system. And I don't think you will have issue that old technology and the new technologies conflicting each other. So having said that, I think in terms of digitalization of medical system, especially coming back to the MCH handbook, we have a lot to learn from each other. So the digitalization of medical, we have to think about the benefit because it looks obvious for us. So through this summit meeting, how this digitalization of this mother-child handbook can contribute to the development of the society as a whole, and what's this digitalized handbook? What's the expectation of digitalization of this handbook? We have to realize that, and collaboration between or amongst Japan and African nation is going to be even more important.
Next, we will have a welcome speech by Ms. Sachiko Imoto, Senior Vice President, Japan International Cooperation Agency, JICA.
The person who moderates. Professor Miriam Kiwele, the first Noguchi Hideo Africa Prize laureate, Professor Keizo Takemi, Parliament Member of House of Councillors, Professor Yasuhide Nakamura, President of Friends of the WHO Japan, and Professor Emeritus of Osaka University. Distinguished speakers and panelists, dear participants, ladies and gentlemen. It is a great honor and privilege for me to make a welcome speech at this TICAD8 side event. African countries have shown significant improvement in the area of maternal and child health in recent decades, as seen in the decrease of maternal mortality ratio, infant mortality rate, and under 5 mortality rate. However, we are still facing a big challenge. About 65% of maternal deaths and 54% deaths of children under 5 occur in Africa. To tackle this situation, the global community has come up with the concept of universal health coverage, or UHC. UHC has continuously been the main agenda in the recent TICAD during the decade. A good entry point to UHC is maternal and child health, or MCH. The health of the first 1,000 days matters for the rest of the life course. Continuum care for maternal, newborn, and child health is therefore crucial. Maternal and Child Health Handbook, or MCH Handbook, is an effective tool for this purpose. The MCH handbook is for personal health records of a mother and her child in one book, which are used for regular consultation, follow-up, referrals, and emergencies. The handbook also empowers mothers to be the owners of their own and children's health records. The handbook helps raise the mother's awareness of health and encourages mothers to take charge of their family's well-being with important health messages. Based on Japan's experience, Japan has provided cooperation and shared knowledge on the MCH handbook with other countries. The MCH handbook is now used in over 30 countries around the world through JICA's cooperation, including 13 countries in Africa. However, COVID-19 pandemic has interrupted the access to essential healthcare services, and mothers and children had often been obliged to stay indoors or had anxiety of visiting health facilities due to COVID-19. The pandemic taught us the necessity of resilient and sustainable UHC, including MCH services. One of the keys to it is utilization of digital transformation. During or even before COVID-19, we observed a lot of digital innovation and change occurring in the continent, such as digital payment, online consultation, pharmaceutical services, and digital vaccination records. In line with these innovations, several countries have started the digitalization of registration, health records, and tools of MCH, which may contribute to the development of the digital MCH handbook in the near future. While digitalization can improve the quality and efficiency of MCH services, we must pay close attention to those who do not have access to digital services and digital devices, especially the poor and the vulnerable, to ensure no one is left behind. We gradually observe the success of cases and challenges around digitalization. In TICAD8, held in Tunisia last August, Tunis Declaration was adopted. It was emphasized to commit to achieving UHC with attention to health issues as maternal, neonatal, child, and adolescent health, including through promoting the maternal and child health handbook, while commending the ongoing efforts to accelerate the effective and efficient use of digital technology in health sector. In concluding, I believe that it is meaningful to have this opportunity to share experiences and knowledge of stakeholders involved in the MCH handbook and maternal and child registry, including its digitalization, for the improvement of MCH and achievement of UHC in Africa. I look forward to fruitful and continuous discussions following this event. Thank you very much.
Thank you very much, Ms. Imoto. Opening remarks will be given by Professor Yasuhide Nakamura, the President of the Friends of the WHO Japan, one of the organizers of this event. Professor Nakamura was awarded the 43rd Medical Achievement Award in 2015 for his contribution to the worldwide introduction of the MCH handbook.
Yeah, Professor Mama Miriam Uere and Professor Keizo Takemi and Miss Sachiko Imoto, distinguished guests, ladies and gentlemen. Good morning, good afternoon, and good evening. Yeah, we are very excited to hold the Memorial TICAD8 side event of digitalization of maternal and child health handbook and information. On behalf of organizers, Nagasaki University, NPO, Rocinantes, Friends of WHO Japan, I would like to have an opening remarks very shortly only within 3 or 4 minutes. The Maternal and Child Health Handbook was born in Japan in 1948 and now flourishing around the world, including Africa, in more than 50 countries and areas. And the characteristics of MCH handbook are very simple. One is an integrated health record of both a mother and a child. Second, essential health information available at home. The 13th International Conference on MCH Handbook was held in Toronto, Canada in August 2022. The conference was chaired by Dr. Shafi Bouillon from Toronto University, with 149 participants from 61 countries. The Toronto Declaration tells that MCH Handbook integrated EDI principles into healthcare equity, improved access to quality care for underserved population, diversity, cultural sensitive services by a bottom-up approach, inclusion, specific needs, for example, low birth weight newborns and children with developmental disorders. The digitalization of the MCH handbook, today's main theme, also supports establishing a population database, tackling health myths and misinformation, and improving adherence to health prevention measures. Digitalization of the MCH handbook. Now, many types of digital MCH handbook or eMCH handbook with integrated health record of both mothers and children and essential health information are available in digital technologies, including mobile phone, application, YouTube, SNS, and cloud computing. Mother and child MC registration is to identify all mothers and children's correct and analyze anonymized data of mothers and children, and utilize data for the quality of life of mothers and children through public health research and policymaking channels. For achievement of the goal of SDGs, MCH handbook, both paper and digital, and maternal and child MC registration are the key important tools to encourage the reality of no one left behind in the health and well-being of mothers, newborn, and children. I hope all the audience will enjoy a presentation from 4 countries and today's discussions, and please bring back something to your own place of work or your business or your research place. Thank you very much for your kind attention.
Thank you very much, Professor Nakamura. Now, we are going to have presentations from 4 African countries on the respective situations regarding the digitalization of the MCH handbook and the MC registration. Each 10-minute presentation will be followed by a panel discussion. From this point on, Ms. Kaoi Nakasa is going to moderate the discussion. Okay.
Kawai-san、ミュートです。
Sorry, we can't hear.
OK, OK.
あ、聞こえますか？
we can hear. はい、聞こえます。We can hear.
Oh, okay, sorry. So, as per the introduction from the Dr. Kato, Sorry, as per the introduction from Dr. Kato, we are having the presentations from the 4 African countries, which is from Cameroon and Kenya, Sudan, and Ghana. So at first, we would like to invite Dr. Mbore Grace from Cameroon. So please, Dr. Grace, floor is yours.
Thank you, Madam Moderator, for giving me the floor. Ladies and gentlemen, I have the pleasure to present to you this day Cameroon's experience in the development and use of the MCH handbook. We shall follow this plan as projected. Cameroon is a Central African country situated in the Gulf of Guinea. It is bounded by the countries as you've seen projected by Central African Republic, Chad, Nigeria, Atlantic Ocean, Gabon, and Congo. Cameroon has a population of 26.6 million inhabitants. Women represent 51% of the total population. The total fertility rate is at 4.6%. Literacy rate is at 77.07%. The MCH handbook in Cameroon is issued at booking, the booking visit. It is filled by health providers in the health facilities in Cameroon. Digital health recording in Cameroon in most health facilities is limited to district health information system for the reporting of health statistics. Smartphone and internet penetration rate in Cameroon is at 40% and 34% respectively. The major mobile networks in Cameroon are MTN and Orange. Within the framework of JICA's dialogue training program, with implementation in a participant's country, the MCH handbook was introduced in Cameroon in May 2010, that is 12 years ago, with goal to contribute to reduce maternal and child mortality, and main objective to progressively scale up its use to nationwide. With monitoring, evaluation, and progressive scaling up of its use, coverage is now at 22.2%. The first 2 editions of the MCH handbook, the first was introduced in 2010 and the second in 2013. They are separate French and English copies, while the third edition introduced in 2016 is a bilingual edition with both French and English in the same booklet. The specificities of the bilingual MCH handbook, that's the third edition. Both the French and English languages are merged in one booklet. You have red headings and bullets for the French language, then blue for English. It has 68 illustrations and contains a certificate of immunization to be signed by a health provider on completion of routine immunization. Useful telephone contacts are on the back cover page of this booklet. This is an exemplary how it looks like. When you see any color red, it means that it's French, and the corresponding French headings and the corresponding blue are English headings. And that's how it presents. This is a vaccination certificate. The reasons for developing a bilingual MCH handbook in Cameroon are as follows. Cameroon is a bilingual country. The official documents and tools in Cameroon are translated to both languages. In 2017, the MCH handbook was adopted as a unique tool for follow-up of mother and her child up to 5 years of age. It is economically cost-effective, and it facilitates communication between health providers and service users, irrespective of the language of each other. The results of implementation and evolution of the MCH handbook in Cameroon. Starting with an initial 1,000 copies of MCH handbook in 2010, the number of copies of MCH handbook increased progressively until they peaked in 2019, when many health facilities were recruited. And presently, we have issued 212,000 copies of MCH handbook in Cameroon. Also, trained health providers, the number of trained health providers is also increasing progressively. The impact of use of the MCH handbook on major MCH indicators in Cameroon. Following results of Cameroon Demographic Health Survey 2018, the child indicators of under 5 mortality and infant mortality have been seen to to decrease, as you see on the diagram. And this decrease is in direct correlates with the number of MCH handbooks that were issued during that same period. As well, it showed improved nutritional status of children within the years. That also correlate with number of MCH handbooks that were issued. For maternal health indicators, health facility births increased. There was also increase in antenatal care uptake rate, while maternal mortality dropped from 782 in 2011 to 467 per 100,000 live births in 2018. Also, it showed to show increase in uptake for intermittent preventive treatment for malaria, as we see here. All these improved indicators correlate with the increased use of MCH handbook between the year 2011 and 2022 in Cameroon. The strengths for the MCH pilot project in Cameroon. Cameroon's bilingual MCH handbook serves as a template for English and French French and English-speaking African countries. The MCH handbook is very much appreciated by the service providers and service users where it is in use. The MCH handbook project can readily incorporate the innovative MCH app. Digitalization of the MCH handbook would be an added value to the MCH system in Cameroon. The challenge is that MCH handbook use is not yet nationwide in Cameroon. Prospect that MCH handbook will be connected to the health information system of mothers and children. Considering the situation in Cameroon, a software application, MCH app, can be developed to relay health information in the MCH handbook to mothers by use of mobile phones. Appropriate alert messages and notifications can be transmitted to pregnant women and mothers of children under 5 years on MCH issues. Service users can receive notification on upcoming vaccination and appointment by automated messages. Digitalization of the MCH handbook would benefit all children and mothers, including those who cannot use the MCH handbook through policy made using data from the MCH registry. It will serve as a motivating factor for health facilities to acquire the MCH handbook to satisfy clear demand with eventual scaling up of nationwide use, which was a major challenge in implementation of the MCH handbook in Cameroon. Success use of the MCH handbook as a tool for continuum of care is evident for the feasibility of piloting the digitalized MCH handbook and MCH registration in Cameroon. Conclusion, the MCH handbook turns to be a tool to improve mother and child health in Cameroon. Digitalization of the MCH handbook by introduction of an MCH application is a feasible innovation that can be piloted in Cameroon with possible partner support. These tools will enable better decision-making, better quality of antenatal and perinatal care, and a reduction of maternal and infant mortality in Cameroon, and contribute to public health in Africa. There are some landmarks in the evolution of the MCH handbook in Cameroon that I just have to go through quickly since time is against us. One of the major landmarks is Cameroon's participation in the 8th International Conference on MCH handbook that was held in Kenya, in Nairobi, Kenya in 2012. Cameroon participated in this event for the first time. And guess what? Cameroon was the next host of the international conference. Cameroon's participation at TICAD8 summit in Yokohama, Japan, where Cameroon was approved to be the host of the next MCH conference. You see Madame Kemi Bando, who was presenting the Cameroon bilingual MCH handbooks. The visit of the global chair of the International Committee on MCH handbook, Professor Nakamura, to Cameroon was another great landmark. He had audience with the Minister of Public Health of Cameroon, and he approved Cameroon as the next venue for the international conference MCH handbook. He also had a press conference where he appreciated the bilingual MCH handbook. The visit of the Secretary General of the International Committee on MCH Handbook, Madame Ekemi Bando and Dr. Anike Kessler in Cameroon was another landmark because they gave some input into developing the 3rd edition of the MCH Handbook in Cameroon. Then the highest event was Cameroon in 2015 when Cameroon hosted the 9th International Conference on MCH Handbook. This conference was under the patronage of Cameroon's First Lady, Madame Chantal Biya, and it was chaired by the Minister of Public Health of Cameroon in the presence of 7 ministers and 2 secretary generals. It had the participation of 287 from 19 countries. Other activities that mark the MCH Handbook in Cameroon are launching activities like that in the far north region of Cameroon. There are always a crowd pulling event with community mobilization, as you can see in the pictures. In 2016, the Minister of Public Health had an audience with the Director General of SUPECAM, that's the major printing press in Cameroon, to discuss on modalities to centralize printing of the MCH Handbook. And also in 2016, the project coordinator of MCH Handbook in Cameroon underwent capacity strengthening in Japan. The Cameroon also participated in the 10th International Conference on Maternal and Childhood Handbook in Tokyo, Japan in 2016. The Cameroonian delegation was led by the Cameroonian ambassador to Japan. There we had the Tokyo Declaration. Cameroon is also represented as a board member of the International Committee on MCH Handbook, as you can see here. Ladies and gentlemen, we hope that Cameroon is a potential African country to pilot the digital MCH Handbook and MCH registration. Partners' support shall be well appreciated. We hope that where there is the will, there is a way. And this is demonstrated by this rainbow that we caught in the sky in Cameroon during one of the major activities of the MCH Handbook in Cameroon. Ladies and gentlemen, thank you for your keen attention.
Thank you very much, Dr. Grace, for your presentation. It's such a great experience from Cameroon. Next, we would like to invite the team from Kenya, Dr. Muo from Central Institute of Medical Research, and also Medical Research in Kenya, and also Dr. Yoshinori Koda from NEC, and Ms. Kazuchi Miyamichi from the Nagasaki University. Floor is yours.
Thank you, everyone. I take this opportunity to give a brief summary about the report on MCH on booklet in Kenya. I would like to invite my colleague Miyamichi to give his presentation, please.
Okay, thank you very much. Thank you very much, Dr. Muo. Yeah, thank you. The first page, please. I'm Miyamichi, Kazuchio Miyamichi, working for the Africa Research Station of NUITM, Nagasaki University Institute of Tropical Medicine in Japan. NUITM works together with KEMRI, Kenya Medical Research Institute, under a collaborative agreement. The NUITM KEMRI project conducts various projects in Kenya. We present today here our activities in Kwale, coastal Kenya, the pregnant women and infant registration WIRE system and the vaccination management system VMS. I present WIRE system, then Dr. Moore and then the other colleagues will follow. Stated in the teacher, Professor Mwede, Mother and Child Health Handbook is widely used in Kenya now. It captures information on various things like including antenatal care, ANC, and PNC, postnatal care, including vaccination history. But the captured information remains still underutilized for public health purpose. Okay, the WIRE system aims at digitally registering the information recorded on an MCH handbook. And it is a facility-based online registration system. Trained nurses and the support staff enter in the WIRE system the MCH information using a laptop computer connected to the internet. The picture shows our field coordinator is taking informed consent form from the mothers. And while the system runs currently at 9 dispensaries and hospitals in the area, they can access the same set of information through the wire system. There's a cases where pregnant women prefer giving birth at hospital and visiting a nearby dispensary for the PNC, for example. Even in such cases, the dispensary can access to the wire system and to get the information of childbirth. Okay, I give the baton to the Dr. Moore for his presentation of the next slide.
Thank you very much, Miyamichi. I'm going to talk about the vaccination management system as part of WIRE, which we've been actually making it better and improving it over time. And we are in a position where we can talk about it in an advanced method and show that it has actually moved to where we want. The vaccination management system actually stores profile of both mothers and children and the vaccination schedule for the babies. It adapts the biometric technology, which captures newborn for precise operation to be able to get all the information you need from the mother and from the children. Next slide, please. So how does this unique technology apply with the biometric identification? We use 3 types of approaches doing that with biometric identification of the VMS. For adults, we actually take face and voice. And for children, we actually improve the system such that we can actually capture the fingerprint of newborn. And we actually began from 2 hours after birth because we actually wanted to be able to get the child from birth up to the end of their life. So the newborn fingerprint identification method actually registered babies, as I've said, at birth, during delivery, 2 hours after that. And it provides the capability to track vaccination schedule and also being able to help the healthcare workers to actually know how the vaccination capacity in terms of children to be vaccinated are in a facility. So I would like to call my other colleague, Koda-san, to please take it over from there.
Thank you, Dr. Moore. Hello, everyone. My name is Yoshinori Koda, a senior research architect of the biomedical technology at NSC Corporation and a corporate researcher at the Nagasaki University. And at this phase, I would like to add some more information about the technologies as an update. And BMS system has a unique function to identify the mothers and the babies by biometric technologies. And the biometric technology has advantages and disadvantages at each technology, like trade-off between accuracy and user friendliness. So we selected the 3 biometric technologies by considering making the on-site operation more easy and precise. And as the Dr. Moore explained, we implemented the face and the voice identification technology for adults and fingerprint identification technology for babies to realize the functions of tracing the vaccination history properly. So I'd like to ask Ms. Rukia to explain an actual operation at the health facility in Kenya. Ms. Rukia, please.
Hello, everyone. My name is Rukia Hassan Ali, and I'm going to walk you through the actual collection. Yeah, I'll show you what we do and how we do what we do. Yeah. So the first process is the informed consent process. As you can see in this picture, before taking any information from the participants, they have to agree to take part in the activity, right? So as proof of their agreement, they'll have to sign the consent form, hence the informed consent process. The second process is the profile registration process. In this process, we collect the participant's information, which includes the physical address, her national ID number, and her phone number for easy identification. And the third process is the image registration process. In this process, we capture the face here. We take picture, the front part, side, right side, and left side for visual verification. The fourth process is the fingerprint data registration. As you can see here, this is how we record it. The fingerprints, we take 4 fingers, the right index, right thumb, and left index, left thumb. Those are the fingers which we capture in the system. And then finally, the 5th process is the vaccination data registration process. This is the final process whereby we collect the vaccination given to the infant, be it at birth or at 6 months, depending if the mother has revisited the same facility again. Next slide, please. Yeah. And this is how the activity is done. You can see we have our scanner there, and that's how we capture the infant fingerprints. We have to place the fingerprint there 4 times. Yeah. No. Can you go back, please? We have to take the fingerprint 4 times. As you can see, in each hand, you can see 4 checkboxes. So we collect the fingerprint 16 times. This, the reason as to why you collect so many prints, it is so that we can match the fingerprint patterns. Next. After collecting the fingerprint, you go directly to the vaccination, whereby you check whether the baby has been vaccinated or not. Yeah, that's all. Thank you. So I'll let Dr. Moore finish up with the conclusion.
Thank you, Rukia. Just as a summary of the progress we have made so far, it's important to note that we began with the MCH booklet, but we actually realized that having the children biometric system as a unique identification would actually improve the MCH booklet and the tracking system and the proof, make it easier to track and to have the babies on board. So as part of that, New Team Camry project will actually keep on contributing to the MCH booklet and digitalization of the handbook in Kenya. At the same time, we'll keep on evaluating the cutting edge technologies through biometric and other technologies which will enhance the healthcare in Kenya. And lastly, we will actually provide, share the findings with stakeholders and other global partners for the on-site research for VMS in Kenya. I'd like to end there and thank you for giving us the time to present this work. Thank you, Sante.
Thank you very much from the presentation from Cameroon. Kenya. It was a great initiative, and we would like to hear more about later. The next is we would like to welcome Dr. Ahmed Saeed from Al-Zayem Al-Azhari University from Sudan. Dr. Ahmed, the floor is yours.
Thank you very much, Mr. Chairman, ladies and gentlemen. It's a pleasure to be with you here today. First of all, I would like to thank the audience. I would like to thank our esteemed guests, Professor Ware, Professor Takema, Ms. Emoto from JICA, and of course, Professor Nakamura, and the family of Nagasaki University. It's a pleasure to be at this meeting. It's a pleasure to, and we would like to give to you what we in Sudan here hope to achieve by this from this conference. Now, I don't know if you can see my screen. If you can see my screen, which I'm sharing now, and let me just share it with you a minute. Okay, can you see my screen now? Okay, excellent. Thank you very much. So what we want to give you is some perspectives from Sudan. It's very encouraging to hear what we had from our colleagues from Cameroon and Kenya, and we hope in Sudan here we will be able to achieve some of the ways in digitalization. Now, unfortunately for our audience in Sudan, we have lost our Zoom, but we will share it with them later. So as has been explained very nicely, maternal mortality is very high in sub-Saharan Africa as opposed to the rest of the world. So we have to tackle this, and we have a lot of things to do to be able to tackle it. For us here in Sudan, we have been doing some progress over the last decade, and our maternal mortality has decreased quite drastically. However, we have a lot to do. As you can see from the figures here, the total maternal mortality in Sudan is 295 per 100,000. However, this is nowhere in comparison to some areas of the world where the maternal mortality is zero or even in less than double digits. So we have to do a lot of work to be able to reach this. Now, if we look at the causes in Sudan, it is the same as what is in Africa. So I decided to show you this slide of what is present in Africa from the literature that has been published. In Africa, our problems are quite obvious. We do not have proper antenatal care. This improper antenatal care is manifested in two main things. Number one, instead of the routine 4 visits that each patient should be getting in her antenatal care, unfortunately, we are usually getting about 1 visit, which is not appropriate. And more so, the content of the care itself is quite poor. Instead of the 6 routine components of antenatal care, our patients are usually getting an average of 1 of the routine care. So really, the literature is quite clear, and there is evidence that I've shown in this slide here for this same thing in Sudan. If we go further, this lack of proper antenatal care in Sudan is causing our maternal mortality. We have this Zoom talked about it. These causes in Sudan are preventable. We have a lot of hemorrhage, we have hepatitis, we have sepsis, hypertension, all things that if we have proper antenatal care could have been prevented. And more so, the UNICEF has shown us more data in Sudan that the fact that these causes are preventable, if we have a better antenatal care, we will be able to have less death due to our antenatal care, and these less death due to would result in decreasing our maternal mortality. Now, so we know that we have a problem. However, this problem that we have, what is the solution? It is obvious, provide better antenatal care. And to do this, the WHO has shown us what is our roadmap to be able to do this. It is digital adaptation for this antenatal care. And further in this roadmap, it's quite obvious. You have in Japan this very nice MCH handbook that by adopting it, we can solve a lot of our problems. So how do we solve them? Well, we adapt this to digital format. We mobilize our midwives or our community health workers. It will lead to better antenatal care with early detection of the danger signs of pregnancy, leading to safe delivery and better pregnancy outcomes and earlier management of our complications. Now, To do this, we will depend on the fact that in Sudan, the mobile phone penetration is very good. So over the last 20 years, this has increased quite markedly from something like 0.07 in the year 2000. Now our mobile penetration last year, 2020, was 80%. So really, this gives us a very good base to be able to start from. The number of midwives in Sudan is about 22,000, which translates to about 1 per 1,000 or 2 per 1,000 of our 1 per 2,000 of our population. So again, we have quite a good base to be able to do this. If we combine the fact that we have good mobile phone penetration and the fact that we have an adequate number of midwives. However, our solution would be quite obvious. We get these midwives to do supervised antenatal care through a mobile platform, as we just explained. But we have to take into consideration, to be able to do this, we need to have special training for our midwives. So what do we do? The steps forward. Number one, we need to adapt the MCH handbook to our local circumstances. So to customize it to what we need, as has been done quite nicely by our colleagues in the Federal Ministry of Health. Next, after we do this, we adapt this into a software, which I'll show you we have already begun to do. Then to train our midwives and to educate them to be able to use this properly. And then from then on, we have to pilot this and then disseminate it to the rest of Sudan. We have already started this, as I can show you here, and we think the future is quite good. So we can have a full history of the full antenatal care package adapted digitally, as shown you here on the right. And we have even gone a step further. We can adapt further things into it, like a digital stethoscope or an ultrasound. And even better still, something like anemia monitoring, which is part of the antenatal care package. We have a program now to be able to do non-invasive anemia monitoring for patients with one of our cooperatives. So to integrate this, we will be doing the full antenatal care package by the midwives in the houses of the pregnant ladies. So cutting a lot of the barriers to antenatal care that one of our colleagues has mentioned before, something like the financial burden, the fact that the health system is not widely spread over the country. So it is a financial burden again for the ladies to go to reach the health system. And lastly, Mr. Chairman, ladies and gentlemen, what we are already piloting here is what I'm showing you in this slide. We can train the midwives, as we have been doing here by our colleagues from the Faculty of Radiology. We train the rural midwives to do proper antenatal ultrasound, which is something that they pick up quite quickly and are able to do quite easily using the mobile devices. In this case, an iPad, as shown in this picture here, but this can be translated to their mobile phones, where the technology has been picking up quite quickly, very all around. So we should be able to utilize it. So, Mr. Chairman, ladies and gentlemen, if our midwives are able to get the data to be able to do the full antenatal coverage easily on their mobile phones, if they're able to do anemia monitoring, if they're able to do antenatal ultrasound, I think that will be the full package to enable them to do for the full antenatal care. And imagine we are reaching out to the midwives, to the pregnant ladies in their homes. And if we do that, then we are cutting a lot of the barriers and we will be able to do full antenatal coverage. And that, Mr. Chairman, ladies and gentlemen, will lead to cutting down our maternal mortality. And I thank you very much. And we thank the cooperation of Rosinante's organization and the Japanese government to enable us to do this. Thank you very much, Mr. Chairman.
Thank you very much, Dr. Ahmed. Lastly, we would like to invite the team from Ghana, Dr. Patrick Kuma-Abogai from Director General of Ghana Health Service, and Dr. Akiko Hagiwara from JICA. Floor is yours.
Hello, good morning. Okay, go start this. Hello, good morning.
Sorry, my microphone was mute. I hope that you can see the slides now. Am I sharing my slides?
Yes,
okay.
Dr. Hagiwara, yeah, we can see you.
Okay. So it's
Okay, we can see the slide.
Sorry. Am I sorry, I have to, okay. Can you see me and can you hear me? Okay, this is my great pleasure to talk about the MCH record book in Ghana and the digital application expectations, about the contents, the record book in Ghana and expectations in Ghana. My name is Dr. Akiko Hagiwara. I'm the Senior Advisor at Japan International Cooperation Agency, JICA. I've been working with the Ghana Health Service last 6 years about the development of the MCH record book there. So this is the Ghana MCH record book completed in 2018. This is the home-based records for mothers and children. It also contains the health nutrition messages, and it has been utilized at all over the places, all at the facilities and the home in the country. It is well accepted by mothers, family members, healthcare providers, and the community. This is the MCH record book looks like. It's a record of ID, and also it is the health education messages during the pregnancy and the child care, all through. These are the record parts of the MCH record book. Has all in one book, and also health information messages with the illustrations. Now I would like to talk about what is the expectation for the digitalization of the MCH record book in Ghana. So the thing is, the MCH record book already achieved something good, and we expect that the digital application would expand what has been achieved with the MCH record book in Ghana. So MCH record book improved the utilization of the service, and we hope that the digital system will improve more of the service utilization with the reminder to the clients and the follow-up of the defaulters with the digital system. We also hope that the MCH record book is already the personal data readily available, but it will be more available at the various service delivery points merged with the clinical patient records by the application of the digital system. We also hope that the nutrition counseling service will be conducted better with the standardized way, because the digital job aid will assist healthcare providers to conduct nutrition counseling more systematically with the algorithm. We also hope that the filling rate of the MCH records would increase with digital applications. We still need more evidence on this. And we finally think that the knowledge and practice of mother will increase more, because the digital system On-demand audio-visual messages with the selection of their language may enhance more knowledge and more practice among the mothers and caregivers. So finally, this is the point that I want to make. MCH record book is filling the gap of the health system already in equity, quality, and accountability. But with the applications, we would like to know how best these applications can enhance further the known benefit of the MCH record book. And we shall explore the best mix of the paper and the digital system. So this is all of my presentations, and I would like to invite the Director General of the Ghana Health Service, Dr. Patrick Kumar Abuaje, for his further elaboration of the digital MCH handbook and digital systems. Thank you. So now I'm gonna share the Dr. Abuaje's presentation. Am I sharing the Dr. Abuaje's presentation now? So I'm gonna make it to the, slideshow. Dr. Abuaje, floor is yours. Dr. Abuaje, the floor is yours.
You have to share yours first.
Dr. Abuaje?
Okay, Dr. Abuaje, floor is yours.
Is song clear? Hello?
No,
Yes, we hear. Thank you very much.
Hello, Patrick-san.
Thank the team for making Ghana join to do this presentation. Like other countries, our aim is to make a case as to why it's important for us to digitize our MCH record book as part of the national digitalization process. In Ghana, the MCH's services are virtually universal. It is free. We have antenatal coverage of about 95%, skilled delivery of about 80%, as well as a postnatal coverage of about 90%. So our goal is for the universal health coverage to ensure that quality, accessibility, and affordability of health services. And we use ICT, and we also believe that ICT presents new opportunities and challenges for achieving our universal health coverage. And that in line with the WHO World Health Assembly Resolution 58.28, we want to use e-health as a long-term strategic plan in developing our services. Next slide. The MCH has really helped us a lot. Document has helped us. It's a comprehensive document of each episode of pregnancy, childbirth, growth, and development up to 5 years. Then, as mentioned earlier by Akiko, there's information and education messages on MCH, nutrition, child growth, and development and milestones are all there. It's also a ready-to-use data for health planning and implementation for Ghana, and enabling organizations dealing with the vital national statistics to have information on newborn for inclusion and population and demographic programs. Currently, we are digitizing our birth and death registry, and based on that, from MCH records, we're able to provide about 85% of deaths, births to all to the system, and we are currently making sure that that becomes a national distance. And then every newborn is given a national identification card, which will help us in the long run. Next slide. The government has embraced digitalization as a key policy goal. as I said, and recently introduced several programs to develop a more digitally accessible public sector and promote transparency and efficiency in order to drive the growth of the economy. MCH Record Book has proven to be a valuable tool for mothers. The existing challenges of operational challenges is the procurement and utilization of the books. And here, it's because of funding. We need to produce about 1 million copies. And so digitization will ensure that that cost is removed or at least decreased. Healthcare digitalization remains a critical agenda for the health sector. As I said, the national identification services cover from about 5 years, that's 6 years and above. But the baby born through this record book is given an ID card, an ID number, so that from 5 years, 6 years, they are able to start using the record book. So digitization will make it easy to merge data and be able to collect national data much more easier. We want to use digitization again to improve the overall performance and quality of care. We want to make some information accessible in a form that will be user-friendly. We want to create a platform for health systems, as in the national identification theme, as a repository of data research and planning. And digitalization, as we are saying, especially of the record, will provide ready-made information for educational services and identify children with special needs by referring to these records digitally. Next slide. Now, so where are we as far as the platform? What the basis? Are we ready? In our 2026 ICT survey showed that 63.2% of mobile phone penetration in urban and 34% in the rural dwellers. In Ghana, urban rural population about 50-50. 20% of urban dwellers have access to internet, while 12.8% have rural dwellers have access to internet services. Next slide. We have since the early 2000s been working on ICT. So we had our first ICT policy in 2005, our enterprise architecture assessment 2008, the national e-health strategy, the first one was 2009. And then we also have the Ghana Health Service, where I had our own enterprise architecture developed way back in 2009. We also have an ICT for accelerated development policy, which was drafted in 2016. The 5-year digital health roadmap for developed in 2018. Our e-governance interoperability framework 2022. And currently, we have just developed, finalized a draft of our own digital strategy as a Ghana Health Service. Next slide. We have been using applications a lot. This is to show that the system is ready to manage it. We have a district health information system, so all our summary records are digitalized. I have a GHS e-learning platform. We have the e-trackers for transactional data for several areas like HIV, malaria, EPI, etc. We have mobile application for family health, family planning, and adolescent health. Next slide. We also have a lot of technology for distribution of our nets, applications for chemoprophylaxis for malaria, level side management. They are also, that is to show that we are used to the technology and to enhance our performance much better. Next slide. We also have the human resource information management system. We also have a lightweight e-healthcare, which is an electronic medical record system, for which currently over 200 facilities are linked. And so we are able to pull data from anywhere. We are hoping that by end of next year, all our facilities would have been linked to the system so that access to records, including the Maternal, the MCH record book, will be available. We started several telemedicine platforms and JICA is helping us. So the existence of this platform, and the existence of implementation in all regions, with the fact that we have the expertise in the health sector, The fact that we have committee constituted to oversee these things creates the environment that we can also do a digitization and make of the record book and make utilization of coverage much, much higher than we have now, especially the completion and utilization for decision-making of the record information that in that rich book. Next slide. Next slide, please. So our objective for digitization is to enhance services utilization for continuum of care and cover all mothers and children, and the objective and must have a very clear objective. Next slide. So what we're hoping to do, currently the record books are moved into summary data and our registers and are entered digitally on our data platform. We can also ensure that what we are trying to do now for digitization is to put them on application and then also do a pilot test for data management whilst we scale it up nationwide, as we did with the introduction of the record book. Next slide. A lot already is being done. We are already digitizing aspects of the record book. We're in collaboration with Ajinomoto Foundation for nutrition, as you can see, all to ensure that the health worker has all the information on a platform that they can use to educate and also render services. So you're going to have to do the maternal health, the health worker one, and then the family one, where they will have that for access to information and the facilities will be able to use to take decisions. Next slide. So our way forward is lessons learned from the pilot of digitization for health, MCH record for health workers is going to be used. We are going to develop a proposal based on lessons learned and scale up digitization of the record booking to use by mothers in several regions. Hold discussions with the requisite stakeholders in the telecommunication, telemedicine, statistics, maternal and child health, and draw blueprint on digitization of the record book, and share experience with JICA and other lower middle income countries on digitization and other relevant documents. Want to use this opportunity to thank the organizers, Akiko, and the JICA team for the immense support that they've given us over the years to come up with this very, very, very rich document that everybody, in fact, the challenge that is producing, meeting the demand, the challenge. Every mother wants one, and every facility wants to see one. Thank you very much.
Thank you very much from the team from the Ghana. So now we would like to proceed to the panel discussions. So during from full presentation, we have learned from fantastic experiences, success stories from each countries, and how the MCH handbook has been introduced to the country and expanded, and also advanced with like unique, like advanced technologies, like through the digitalizations. So what we would like to ask from each country is next is to like, now it's like we learned that it's expanding, but what are the challenges like your country is facing or may face in the future? What do you think we face in the future in regards to further expand the MCH handbook and also the digitalization of the MCH handbook in each country? So we would like to invite Dr. Grace from Cameroon first. Floor is yours, Dr. Grace. Sorry, it would be great to comment in approximately like 3 to 4 minutes. Thank you. Dr. Grace?
Dr. Grace, mute, please. Now.
Okay, let me mute.
Okay.
Okay, are you getting me?
I can hear you.
You're getting me now?
Yes, we could hear you.
Yeah, Grace-san, mute again, and please check.
Is it okay for now?
Okay, okay, okay. Is it okay now?
I'm unmuted. Okay.
Please go ahead.
Okay. Concerning the first question, what are the challenges which each country is facing or which each country may face in the future to further spread the digitalization? For Cameroon, the Cameroon health system is not digitalized. Incorporation of the MCH handbook and MCH registration into the national health system may not be immediate. So we pilot, and we don't expect that it should be immediate since the health system is not yet digitalized. The second challenge is that maximum reach is not guaranteed due to low mobile phone and internet penetration rate in Cameroon, which is at 40 and 34% respectively. So maximum coverage should not be expected in the near future. But with this IT development, it is going fast, but presently the penetration rate is not very high. Question number 2, based on the challenges each country is facing currently or foresee facing, what kinds of support do you expect from Japan regarding the digitalization of the MCH handbook?
Dr. Please.
Hello? Are you getting me? Hello?
Questions. Thank you.
Hello?
Yeah.
I'm getting you.
Yeah.
Am I being heard? Are you getting me?
Yes, yes, yes. Please go ahead.
You're getting me. So I'm presently on the second question. Based on the countries currently or foresee facing, what kind of support do you expect from Japan regarding realization of the MCH handbook and MCH registration? The type of support that Cameroon needs, we need technical support for building and running the MCH application. So we need technical support. We also need financial support. We also need financial support for logistics of building and running the MCH application. Thank you very much.
Thank you very much. So next, would like the team from Kenya. It would be great if one person from Kenya to report.
Thank you, Nakasa-san. I'm going to take it over from there and at least give my input on that. I think some of the challenges which we face as a country is most of the work which we have been doing was more of manual, but the word digitalization coming in, most of the people usually consider like 100%. We hear digitalization and think everything is going to happen 100%, but it's a baby step process. So one of the things which we do is we upgrade the system slowly by slowly so that we can actually achieve the target population for digitalization. One of the challenges being that after getting the fingerprints or the digitalization system, not all mothers will come back to the same hospital. So to cover that, I think the application and training for the community units headed by community health workers in Kenya would actually improve on that. Those are challenges which we face. At the same time, we should also have a system of thinking about the internet connectivity and how to go about it. Because some areas face challenges of internet, but offline versions also work. So that would be also another way of securing that. So in a nutshell, inclusivity in the health sector from the hospital setup to the community level That is health practitioners, community health workers are key in digitalization and part of the challenges which we face on how to train them and link them. And in my opinion, you need to consider several things. One is to encourage sign-ups for people with different registrations at the same time, then create a digitalized use case, which motivates the MCH operations, such as vaccination history management, and overcome delays in the development of the infrastructure, such as electricity, ICT, and network. And the key part is collaboration with the local government, not only the national government, because they are the people who, the local government is the one which is in touch with the people, and create specialized knowledge and training for them. At the same time, we need to find other related things to encourage the digitalization and to top up in the digitalization area. Over. Thank you.
Present. Thank you very much.
Just before I end, sorry, Koi-san.
Yes, go ahead.
I did not answer part 2, our expectations from the Japanese government.
Yes.
I think to answer that, so far we've received some great support from the Japanese government. And one of the main expectations for us is they consider making it huge for the mother-child hand booklet to digitalize it and push it forward so that it is actually part of universally accepted in the as a way of registration in the kids, and actually get more support for training so that is that it can even reach the community level. Over. Thank you.
Thank you very much. So next, we would like to invite Dr. Ahmed from Sudan. Dr. Ahmed, the floor is yours.
Sorry, I think I was muted. I'll just go back again. In Sudan here, I think we have a very good base to start off. The base that we have to start off is that we have 80% mobile phone penetration. And I hope 2 of our big mobile companies are online with us today because we invited them yesterday and they're very interested in this project. So really, we need to get in the heels of this success that they have. So now what are our barriers? Our barriers are the fact that most of the work we are expected to do is through the midwives. Now these midwives, we have to think of the sustainability. What is there for them? These midwives are usually very poorly paid in rural areas. So we need, and we have a plan for how do we sustain them. So number 1, how do we incentivize these midwives? I think there are many things we can do to incentives that we put inside this, and I'll talk in my second part about this. The second thing about these, apart from incentivizing them, these midwives usually, we need to support them by better training and better education to allow them to use this platform. Thirdly, I think really we have to think very carefully, how do we integrate this? And this is another barrier, how to integrate this into our main health system. Now, I go to my second part. What do we hope to get from the Japanese government? It comes from the obstacles that I have. How to incentivize these midwives? We have a plan for this. We do not need help from the Japanese government for that part because this should be a local solution that we have for here. But we need help from the Japanese government in the other 2 things, the training and the education of our midwives, the basic training, and this includes our university midwives and our rural midwives. We in our university here have a school of midwifery. We have the staff who are able to help in this, but we would like help from universities in Japan to send to us lecturers and professors of midwifery to further help our midwifery program here. this will be a very good asset for us. Number one, it will remove the stigma that we have with midwives, which is a problem here. And number two, it will help to train our midwives better if we get this technical cooperation. And thirdly, we do have the technical setup to do this here, but I think support in this aspect also would be very good for us and will help us to establish this program in a good way. Thank you very much, and I hope that answered your questions, Mr. Chairman.
Dr. Ahmed. So next, we would like to invite the team from Ghana. Floor is yours.
Yeah, thank you very much. The challenges are probably similar. We have full scale nationwide, everybody's supposed to use a records book. So the main challenge now is availability for everybody, every child. We're looking at about 900 children, more babies born a year. We also had a backlog of children under 5 who did not get the copies of the record book. They go to the same services and they see someone holding a very good comprehensive book and he has a very small booklet. So that's a key challenge, is how do we make it available to all this cohort of kids? In the last, those who are born now, we are giving them, but we still have a backlog to give them. The second one is incomplete documentation. Not all the fields, even the all of them are not filled. So those are areas that we need to ensure that we empower mothers to make sure they are filled, and then also train health workers to be able to complete all that. Those are the key challenges we have as far as the record book is concerned, and including that will mean the capacity, etc. The other one is that if we are going into digitalization, I think that as I presented, that the platform is quite clear. We already have offline versions of things for our surveillance, etc. that we do. So we have the know-how on how to do offline. So we need to support to be able to get first our equipment fixed, the handheld devices that will be used in making sure these things are done. Appropriate data centers where this data can be processed and decisions they're taken out of them. And then finally, some capacity building within the IT area to help us also scale this up. So currently, we are grateful to the Japanese government again. We are currently doing a baseline assessment, which has been completed for our telemedicine and teleconsultation, which is right on the same infrastructure that will be needed for digitalization. So that will give us a lot of gaps as to where we need to really fill to make sure that this thing goes on very well. So thank you very much.
Floor is yours. Thank you very much. So thank you very much for the concise the responses. Thank you very much. So actually, we have more time. I would like to ask for kindly tell more in detail what's kind of infrastructures are needed in each country to further advance to MCH like handbook and also the digitalization. So
Kaori-san,
yes,
sorry. So we cannot hear your presentation. So that's why. So please.
Yes. Do you hear my voice now?
Yeah, now so we can hear. But so just so 1 minute ago, so we cannot hear your voice. So sorry, please repeat again your comment. So thank you very much.
Okay, thank you very much. So I would like to so thank you very much for the responses to the inquiries. And we see like so since we have 25 more minutes, Dr. Nakamura, is it fine to ask like one more questions like to summarize the what we have like received a response? So based on the responses, I think there are a few common the challenges like which each countries are facing, which are like the need for the to further advance the MCH handbook and also the digitalization, which is one is the infrastructure. So it will be great. This one to be in concise, maybe in 3-4 minutes too. It will be great if each country can provide more in detail what's kind of infrastructure is needed in terms of to advance the expand of the MCH handbook and also the digitalization. So from Dr. Grace first, please, floor is yours. Dr. Grace? Dr. Grace?
Okay, is that okay now? Are you hearing me?
Yes, thank you.
Yes, okay, in terms of infrastructure needed to improve use of the MCH handbook in Cameroon, at this time, we have a coverage of 22.2%. And as I mentioned in my presentation, that with the event of introduction of digitalization of the MCH handbook and MCH registration, it will go a long way to improve, to improve on the use of the MCH handbook in Cameroon. Why is it going to improve? Because when we will develop this, when we shall develop this mobile app, it will be in a way that the users, they will download it. They download it in their cell phone. The application is in their cell phone. And then they'll be having automated images. As one downloads it, there's registration, identification of the user, everything, they fill it, depending on how we develop the app. And then if it's a pregnant woman, we already know her last date of menses, and we'll follow up. If she's in the first trimester, second, third, and so on, we know the type of automated images that we dispatch to this category of women. Once they are informed, and we make them know that the information is found in the MCH handbook on a certain page in the MCH handbook. So you see, it motivates their interest now to know what the MCH handbook is. Even if they were followed up in a health facility where the MCH handbook is not in use, they will surely go and ask that, but this book that I'm hearing, I have an app, and they say there's a book called the MCH book, MCH handbook. Why is it in your health? Why is it not in your health facility? You see, many health facilities now will surely contact a project to acquire MCH handbooks, and they will give them some training, and the MCH handbook will surely go nationwide within a short time. So that is one big advantage with this digitalization. And it will also enable the user, the mother, to have reminder messages to come for children vaccination and other MCH services in the health facilities. And it will form a database, that even project managers, policy makers can come to dig a lot of information on MCH. And that will go a long way now to improve MCH in Cameroon and contribute to public health in Africa. Thank you. So in terms of infrastructure like building, it's a virtual application. We don't need to set it in a building or something. It's a virtual application that just reaches all Cameroonians, no matter where they are. And in this respect, it includes those who will benefit from this application, will include those who have the MCH handbook and those who don't have the MCH handbook. And it will motivate those who don't have the MCH handbook now to have it. So the health system of Cameroon will well improve. I hope I've answered the question. Thank you.
Thank you very much, Dr. Grace. Next, from Kenya team, please, floor is yours.
Thank you very much. To answer that, I think the greatest infrastructure that is required in the Kenyan system is the database, a data center, because digitalization requires storage of data from local government to national government. So each local government should have their own database, and the national government should have the overall database for all the facilities. At the same time, it's also important to note that the other infrastructure and other systems which will be required the trainings where to get particularly the system. Like if you're going to use a laptop or a computer, those are infrastructure, or a handset, an Android phone, or all that collect that data. Yeah, that's another challenge which we need training. But the application also of digitalization and making use of the biometric system also comes up with a good system which will enable us require what is required. So in a nutshell, I think the data center and the data handling facility is the main challenge in terms of infrastructure that is key for Kenya. Thank you.
Dr. Ahmed from Sudan.
Thank you very much, Ms. Chairman. Now, to tell you the truth, when I think of this, we have to divide it into parts. Number one, we need the midwives. Number two, we need the proper database. Number three, we need the ICT infrastructure. Now, when we think of it, the ICT infrastructure, we have it very well here, I think in Sudan. Like I said, 80% mobile phone penetration. We have a lot of very good data centers. So really, we should utilize these. We have them in the government, in the universities, and also in our mobile companies. So how do we utilize this properly? And it has to be a win-win situation. So what is missing here and what we need help with is the training and the education of the midwives. And secondly, the motivation of these midwives. Now, to motivate these midwives, our friends, I have a degree in computer sciences and health informatics. Our colleagues in the computer science departments, they have this very nice thing that I like, which is called gamification. Now, gamification is how to make this attractive and incentive for the ones who are going to be use it so that it is sustainable. This is where we will need a lot of help. This is where we'll need a lot of brainstorming to sit down and see how are we going to train the midwives and make sure that they are incentivized to be able to sustain this project. So, and this is, we have some ideas of how to do this. The good thing for us here in Sudan is in attendance here today, we had our colleagues from the Federal Minister of Health and the State Minister of Health. We plan to sit down with them more to see how do we make this sustainable. The Japanese government and our colleagues from Japan can help us very much in this, as long as we come up with clear ideas of how to proceed forward. Thank you very much.
Thank you very much, Dr. Ahmed. Next, please, from Ghana team, the floor is yours.
Thank you very much. I think I had mentioned earlier the infrastructure needs earlier, but I think I'll still go over them. First is the probably support government effort at extending the network, internet services across the country, and that is very crucial. We cannot just say this for us, others will use them. So that is extremely important, extending. The government is working on it, but we can be facilitated to make it faster than it is now. We also have issues of power, especially in some of our rural facilities. So things like solar panels and solar power system will be something that will be helpful so that they can quickly participate in these areas. And finally, I mentioned that these are data security issues. People are using, because we don't have enough, others are using their own phones and their own tablets to enter people's crucial data. We need to provide handheld data that is secured for the nation for data protection. And that's why we need to expand that to ensure that all those machines are purposely made just to keep the data. People don't carry people's data home or when they retire. So these are the key things, but mainly is to help the country expand this internet base across the country from urban to rural areas so all these things can be done. And we're very grateful for that. Thank you very much.
Thank you very much, panelists. Thank you very much for panelists for sharing the challenges and also for more advancing for the digitalization and also expand the MCH handbook. So to summarize, it seems like there are like a few common challenges, which are the training and also the training to the medical the professional experts, such as midwives, and also the people involved in all this like digitalization of the and also expanding of the MCH handbooks, and for also the infrastructures, so which are from the devices, also from the electricities, and so the data center, which is like quite important for the digitalization, and of course to do implement these things like finance are like are the challenges also. So and based on the also the request for Japan, also it seems like those are the main major point where the supports are needed from Japan. So thank you very much for all the panelists. I think it was a rich the discussion, and also we shared a lot of ideas from each countries. I think I believe like this platform, like we shared all these experiences from different countries, and also we connected through the this discussion. We will proceed to the next step to further expand them. So we would like to proceed to the next agenda of the event. Thank you very much.
Well, thank you very much, Ms. Nakasa. Now, based on the panel discussion, Professor Satoshi Kaneko, Professor of Nagasaki University and Secretary General of this event, will present the future direction and policy of our activities.
Thank you very much, everybody. Thank you very much, Dr. Kato. My name is Satoshi Kaneko, Professor of Nagasaki University. Today, we discussed about the digitalization of the maternal and child health handbook and also mother and child registration in Africa. All the presenters and from each country has several challenges. So maybe we can summarize somehow about the digitalization of the MCH handbook and also mother and child registration as follow. I want to share some slides, today's summary like this. So today we discussed several things about digitalization, but I want to summarize into 3 parts like this. First one here, digitalization on the maternal and child health handbook and the establishment of the mother and child registration necessary. Everybody agree, I think, like this. This one to effectively provide services to all mothers and children equitably, promoting the MCH handbooks digitalization and the development of the MC registration necessary. So we agree now this one. And the second one, digitalized MCH handbooks and MC registration systems should be developed by all actors under a common concept. So now we discuss several challenges in Africa. That's why we must develop the systems to reflect the challenges we have commonly have now in Africa. The last one, third, there is a need for the platform where different actors involved in the digitalization, the MCH handbooks and the registrations can come together and share information. So now we have several things we shared in this panel discussion and the presentation. I think we believe we have to establish a consortium to create a platform for information sharing the discussion. Using this kind of a platform, maybe we can share some information, maybe we can find some solution commonly we have in Africa. And lastly, on behalf of the organizers of this TICAD8 official site event and its participants, in consultation with stakeholders and experts, we want to adopt this conclusion as a TICAD8 declaration on digitalization MCH handbook and MC registrations as a guide for moving forward. Thank you very much, and we will appreciate your cooperation agreement. Thank you very much. I back the microphone to Dr. Kato. Thank you.
Thank you very much, Professor Kaneko. Now, this side event is coming to an end. Professor Naoki Kawahara, President of N3 Los Angeles and visiting professor at Nagasaki University, will give us a closing remarks.
All right. I'm Naoki Kawahara, President of Los Angeles and the visiting professor of Nagasaki University. I'm at Azhar University in Sudan. Anyway, we have some problems. This is Africa, but we did it. And yeah, we did this very good, very excellent side event between Japan and African countries. Thank you very much for everybody's efforts. This is a side event of TICAD8 on the theme of digital maternal and child health. We asked specialists working in Ghana, Kenya, Cameroon, and Sudan to share their valuable opinions on MCH in the countries. After that, we had a fruitful discussion with them, including Japan's MCH initiatives in Africa. I appreciate them for their presentation and discussion. Thank you for giving a welcome speech to Ms. Sachiko Imoto of JICA. JICA should be commended for taking the leader in disseminating MCH handbooks in African countries. I hope that JICA will take the lead in the digital MCH as well. Professor Yasuhide Nakamura is the first person in spreading the MCH handbook to the world, which was born in Japan. He was also working in Sudan as the leader of an MCH project of JICA named Mother Nile Project. In addition, Professor Nakamura leads the World Association for MCH Handbooks. And I'm sure that in the future, he will expand the conference and include the digital field where new knowledge can be obtained. Professor Miriam Were from Kenya sent us a beautiful message. It's wonderful. Professor Were is the first winner of Hideo Noguchi Prize. When Professor Nakamura showed Professor Were a Japanese MCH handbooks, she read it all the way through without sweeping and was amazed how wonderful it was. She must be amazed at the effect of digital MCH handbooks in the future. Mr. Keizo Takemi pointed out the way we should take. The G7 summit will be held in Hiroshima, Japan next year. At the G7 summit, the progress of digital MCH in Africa may be introduced. And TICAD9, this next stage, will be held in Japan in 2025. We have to show the progress of digital MCH in African countries at TICAD9 in Japan. I think digital technology has both positive and negative aspects. But in the area of MCH in Africa, the positive aspects will be used to save the lives of mothers and children, leaving no one behind. The experience gained from digital MCH will continue to medical care, not only in Africa, but also Japan and around the world. In order to save the lives of mothers and children, leaving no one behind, we need to promote digital MCH through cooperation among countries rather than competition. So we need to standardize digital MCH in the near future. In other words, we aim to have the same, almost the same system or a compatible system in any country. By the way, Sudan was not officially invited to both TICAD7 and TICAD8, unfortunately, due to the political problems. However, this side event was non-political, and we were able to get Sudanese people to participate like this. Yeah. More than 50 Sudanese
excellent.
Yeah. We're able to send the event online from Sudan to Japan and African countries. I'd like to thank everyone at Azam at Azhar University for setting up this station. Thank you very much. Thank you very much. Finally, Professor Satoshi Kaneko of Nagasaki University made a declaration of digital MCH. Now, after this event is over, it will be the start of our digital MCH. Let us promote digital MCH project in each country and see you at the next TICAD8 in Japan. Thank you very much. Thank you, everybody.
Thank you very much, Professor Kahara. Now is the time to conclude the TICAD8 official side event, digitalization of maternal and child health handbooks and information, benefits to mothers and children, and contribution to public health in Africa. Thank you very much to all the presenters and the audience.
Sorry, Mizuki-san, and yes? So now, so we would like to take a photo.
Yes.
So, and photo with the participants from Sudan also. We would like to take a photo. Same.
Okay.
So, and if Kato-san can screenshot.
Okay.
أكبرهم طبعا أستاذنا دكتور مروان.
Okay.
Screenshot, okay?
Okay, I can.
Kato-san, you can take a screenshot.
Yeah.
Okay. So
Okay,
please smile. Everybody smile.
Yeah.
Smile.
I will take 2 shots. So, everyone smile.
Okay. ممكن جزء من الناس يكونوا واقفين هنا. هنا برضه ظاهرين.
Professor Ahmed, are you okay? Yeah.
Okay.
ابتسموا يا جماعة قدامكم.
So I will take photo. Yeah, 3, 2, 1. Okay.
Okay. One more.
Please wait. Okay, one more. 1.
Okay.
Okay, 1, 2, 3. Yes. Okay. Thank you very much.
Thank you very much.
Thank you.
Thank you, everybody.
Yes. So we can conclude. Okay. Yeah. Now is the time to conclude our side event. So we'd like to establish a consortium for the digitalization of the MCH handbook and MC registration in the near future, and continue to provide information. Yeah, let us all work together towards the digitalization of the MCH handbook and the MC registration. Yes, thank you all very much for your time today. Thank you very much.
Thank you very much.
Okay, thank you. Thank you very much.
Thank you. Keep in touch.
Thank you. Okay.
Thank you.
Okay. Bye-bye.
Bye. Thank you very much. Have a great night. Have a good day.
Grace, bye-bye.